Hi there. This is Chapter 2, Medical Terminology. I'm Mr. Casella, and we're going to talk a little bit about body structure today. So, body structure, the chapters in this book and the way we're going to learn our medical terminology is going to be based on knowing body systems. And so, we'll start out with some structure, and then each chapter after this is going to deal with different body systems. You'll find that if you can tie your knowledge together and adapt it to a body system, it's going to help you learn and get more out of it than if you just memorize a huge list of things. So each chapter, we're going to go over a little bit about what's going on with the body, systems, prefixes, suffixes, root words, and then diseases and conditions that are related to those systems, all in a hope to help you learn and make your learning stick a little bit better, but also to keep you interested and get something out of it besides just plain old memorization. So that is where we're headed in today's body structure. When we look at the body itself and the structures of the body, the makeup of the body, we have the simplest, smallest structure is going to be the cellular level. And then we have tissues together. So cells working together with a common purpose make a tissue. And then those tissues working together become an organ. And that organ becomes a system. So that's how that part kind of works. And we just look at those different levels, and you can study any of those different areas that are out there. When we use medical terminology, we have to follow medical directional terms, and there's some that we'll use. And it's just like anything, if you're involved in nautical themes like boating, I like sailing. That's one of my hobbies. And we talk about the left side of a boat is always going to be called the port. The right side of the boat is the starboard. And it doesn't change if I'm facing forward or backward. Facing forward in a boat, the front of a boat's called the bow, the back of a boat's called the stern. Well, there's times you need to move around in a boat, and you're not going to be able to always say that the left is the left, because if I'm facing forward, the left of the boat is the left of the boat. But if I'm facing backward, my left is the right of the boat. So we do that with med terms. We'll use certain terms, and it's all in a reference of the body. The body of the person is going to be in what's called anatomical position. In that anatomical position, we have the person standing straight up. They call that standing erect, with their arm or palms facing out, and you can see that. So it's a little different than normal standing. Normally, your hands wouldn't be palm up; they'd be the back of your hands would be showing. But that's the anatomical position. And so then the left of the person is their left, and the right of the person is the patient's right, or the body's right. It's not yours. So we'll use some different terms in conjunction with each other. So anterior and posterior are opposites. So anterior is the front, posterior is the back. Inferior and superior have to do with being above something or a point of reference, or below it. Proximal and distal have to do with the root of attachment of a limb. So like on my arm, the arm is going to be the elbow is proximal to my shoulder, where my wrist is distal. It's further away from the root of attachment. Then we have cephalodad and caudad. That has to do with towards the head or towards the tail. And then ventral or dorsal is the front of the body or the back of the body. Lateral or medial is dividing the body into sides in this direction. So you're looking at right down the middle towards the midline, just like in a street, you have the median, we have lateral. There are also three main planes of reference. So we have medial, frontal, and horizontal. And the videos that I'm including in this particular week talk about all these different things, so I don't have to spend lots of time on this. The dorsal and ventral cavities of the body is where certain organs are found, and we have the dorsal, which is the cranial and spine, and then ventral closer to the body, thoracic, abdominal, and pelvic. In your abdomen, in your four quadrants, we call it, in checking your abdomen, there's different things that are there. And when I teach, one of the classes I teach is EMT, emergency medical technician. We teach people to do a patient assessment where you have to check the body for any injuries. And one of the things you'll check in the abdomen is the 4 different quadrants. So you divide into that because there's different organs in each one. The right upper quadrant has your liver. Your left upper quadrant has your spleen. Your right and left lower quadrants have intestines. On a female patient, there's ovaries there. And we also have in the right lower quadrant is the appendix, which is something that people sometimes have get inflamed and have to be surgically removed. One of those concerns when someone's complaining of abdominal pain. If you get further training into being a paramedic or a doctor, they actually divide it into even more regions. And you can see a lot of different regions. Right hypochondriac. Hypo means below. Chondriac is cartilage. Well, your ribs are made of cartilage, so right hypochondriac is just beneath your ribs. You can see that on the little screen here. So you can look at all these different things. Inguinal is the groin. Lumbar is your lower back. Umbilical is your belly button. So you can look at, they're just terms for different parts of the body. Luckily, right now, this isn't anatomy, and I won't test you on that particular question. But the smallest living structures in your body are cells. And they form together with organs working together to make a system. And that's how that part works. And we can look at more information. You can read through these on your own. I always make the PowerPoints available for you to look with these different terms. So we look at side to side or back of the body or the belly. We'll give you a little guided and extra understanding. In the 4 quadrants, these are pretty simple. They're just abbreviated upper quadrant. So if I was really going to give you a hard test, I would ask you what organ is in your right upper quadrant. But right now, you just have to know the abbreviation. Here are some structural units. When we look at medical terms, we have combining forms. As you remember in my first chapter lecture, if you haven't looked at that yet, you might want to watch my lecture from chapter 1 because we talk about how words are put together and how you solve and talk through medical terms. And when we look at combining forms, chondro, cyto, histo, and nucleo, we can see then terms used, what they mean. So chondro is cartilage and cyto is cell. Histo is tissue, nucleo is nucleus. We can use that with all our directional terms as well. As you can see the combining form and then what those mean as you look at them. The continued descriptions, if you kind of look and zoom in on the picture, you can kind of notice the planes that the body are divided into. Sometimes when a person has, for example, an MRI, magnetical resonance imaging, where they do imaging of the body, the electron beams can go and do a mid-sagittal view, and it can cut to the side, and without having to actually cut the person open, it can digitally do pictures of a person all the way through the thickness of their body along, for instance, the mid-sagittal plane. So it's kind of interesting. You can do the frontal or coronal plane. With the body regions, again, we can see some of the different terms and what they mean. So cephal is head, cervic is neck. This is one, number 14, that you have 2 different usages of the word cervic. Cervical, pertaining to the cervical or neck. An injured patient, we will put a cervical collar on their neck, and that is to stabilize the head. But it's also a part of the uterus. The neck of the uterus is called the cervix. Same combining form, but we add a little bit extra there. So that's just something to be aware of. Some words have a dual purpose, and so context becomes important. Gastro is stomach, thoracic is chest. As we look through, again, some of the body regions, you can read these and have a better feeling for what they are. Here we have around the umbilicus or the navel. So we have umbilic and then AL. The AL means pertaining to or around. So around the umbilicus. IC, the suffix IC means pertaining to or above. So that's above the stomach. As you can see how all these work as you start plugging the words together. Another building a medical word like measure the cell. Meter is an instrument. Cyto is cell. So we put the O in there to make the word pronounceable. And remember, with those rules of combining forms, if you don't know what I'm talking about, check chapter 1. It describes that in the lecture as well as the textbook. Mediad is toward the midline, and you can, again, just plug in. Once you know a root word, you can always know what it means and then add your suffixes or prefixes to qualify it a little bit. So there's a couple different phases of what you want to be memorizing. What's really cool is once you learn, like AL means pertaining to, I can say cervical, I can say any other thing and put an AL at the end of it, and it means pertaining to. So that's a kind of a good thing to know. Tumor composed of cartilage is a chondroma, and then gastritis, inflammation of the stomach. Now we can get into just understanding some vocabulary terms: adhesion, anastomosis, cauterize. Now I'll tell you something out about this. These are terms they always like to use in Gray's Anatomy. So if you watch Gray's Anatomy, you'll see those terms. They love to do anastomosis. They don't oftentimes know what that means. You can learn just by reading the vocabulary term. Inflammation, sepsis, ultrasonography, all very important things to know a little bit about. Sepsis is your body's response to an infection. They have a fever, elevated heart rate, respiratory rate, and low blood pressure. Sometimes a patient will die, or a person, maybe it's a elderly person, or not always. They have an infection that gets undetected. It gets into the body's whole system, and that causes sepsis, and they can sometimes die from sepsis. Next quadrant we'll look at is diagnostic procedures. And when we're looking at diagnostic procedures, endoscopy is one of them. They use a tool. You can actually go in without having to cut a person open and check the insides of their body and examine. For instance, you can go down the air in the esophagus with an endoscope, and you can do a biopsy, take a little piece of tissue out of there and check it. So all sorts of cool things that can be done with that. X-ray is out there. I was talking a little bit about magnetic resonance imaging. So this is a mid-sagittal section of the head. You can see it's like they cut you open kind of in half, but they didn't really. It's all with electrons and magnetic beams. It's very amazing. They can get soft tissue detail. An X-ray, you only get like, you can see bulbs. Sometimes they'll put a dye in there that shows up in an X-ray, but it doesn't show soft tissues very well. That's what MRIs are really good for. Ultrasound uses sound waves to get a picture of what's going on inside the body. And then we have ultrasound, they can use for a lot of different things. They can also check your brains, how your brain actually processes with positive emission tomography. And you put a radioactive material in your brain and then see how it gets used when metabolism is taking place. Sometimes you'll see this on a person that's thinking. There's a lot of metabolism going on. Sleeping, there's not. Or if they're like, I've seen these pictures before on a patient who's normal and someone who's used meth, and it destroys parts of the brain. It's quite interesting. PET scan is what that is called. And as you build medical words, then you'd have to know them to build them. But here we can guess what you would put in here. And then when you learn them, you can see endoscopy, ultrasonography, and gastroscope. An endoscope examines within the body. Tomography is slicing of organs or tissues, or a process of recording, because a graphy is recording. The tool is cutting. And cytologist is someone who studies cells. Hematology, thermometer, radiologist, gastrology. Studying those words can be helpful for you. Here's an example of an anastomosis. It's joining of two ducts together, vessels, bowel segments. It's like when they do a heart transplant, they'll sew the vessels together. Sometimes they'll do it also with intestines as well, or working on a gallbladder. Now, just once you get familiar with the term and then you hear it somewhere else, like maybe in one of your TV shows, you're like, oh, I know what's going on there. Cauterize is to burn. You can burn with electricity, You can freeze, you can use heat or chemicals to cauterize, and a lot of times it's used to stop bleeding or get rid of diseased tissues. They'll cauterize a wart, they'll cauterize a nose that's bleeding to close a vessel. So you can read through, and there'll be a couple where they'll give you a in context, and you have to guess what the words are here. So that is all the information that I really had for you on this chapter. I hope that you found that helpful and that you are able to continue progressing through. I want to recommend that you practice by taking a little time each day. For example, it would be a good idea to take 20 minutes a day to study. You don't want to just do everything 100% at the last minute. And what you'll find is each week I have for you within your Schoology, you've got Quizlets, and that Quizlet is a really good resource for you to study before the test, because that's where I get a lot of material that you're going to be tested on is from the actual Quizlet. So that would be a really good place for you to be looking to get yourself ready for the exams that you take. The exams you're supposed to take without using notes, and you just do your best on them. They are usually due on Friday. So you can see that for this week, it's on there. If you have any questions, you can see me during my office hours. Otherwise, I hope that you are doing great and continue to be nice, make friends, wear your seatbelt even in the back.